How did you organize the U.S. Army, your medical command for COVID?
One of the 5 R's, in my strategy and priorities, ready, reformed, reorganized, responsive, and relevant. The Army is already organized. Our healthcare system is already organized in the United States Army Medical Command and all the operational units that are outside of our fixed facilities. The responsiveness R is where the Army had to adjust, adapt, and overcome. So when COVID hit, in Korea and started in Asia, we were watching it, and then we saw our Army overseas dealing with things that were going to soon hit the shores of our continental United States. So when it hit us, on the West Coast and the East Coast, you saw the Army respond, responsiveness. Now, initially, we're used to calling, when called upon, we deploy, fight, and win wars. Well, this war was something different. It wasn't the sound of the guns, as we say in the military, that we went to conserve the fighting strength to get casualties. It was a silent sound of an enemy, or an opponent, that was taking out the citizens of our country and not just the military. So it was something new for us. And so our organization, we had to adapt. So we took our combat support hospitals, we took our field hospitals, and we initially deployed those to the Javits Center in New York and to Seattle, Washington, to support, our nation, the very first point, ground zeros for the COVID for us. We learned from those deployments that we were not organized correctly. So we had to take our hospitals and we reorganized based on the Health and Human Services field medical stations concept of an 80 or so mixed assemblage of specialties to respond. And so now, as we reorganize, we named it what we called Urban Augmentation Medical Task Force. UAMTFs were what we broke up our hospitals into and started deploying Urban Augmentation Medical Task Force to the different states, countries, and towns across the nation. Now you had 80-something soldier teams that would go into the city that now they could break up and reinforce all the different hospitals in that town, in that state, in that region to provide the backup support and the reinforcing support in support of COVID, because they were overwhelmed, the wards, the ICUs, the ER, overwhelmed, to death, overwhelmed. The UAMTFs was our response of reorganization, our organized force to respond to COVID. And then it shifted from there to vaccine support teams. Now the country needed vaccine support. And so we reorganized into our vaccine teams, where we sent out now the medical professionals as well as the command and control element to support and administer vaccines to the cities and our citizens wherever they were at in response to what we call mission assignments through Health and Human Services from the various states. And then finally, the community-based task force. That's one of the things that I'm really proud of, because there was one of my medical planners, who put that together, Lieutenant Colonel Tiffany Bilderback, that I gave to Health and Human Services and the U.S. Surgeon General, who helped them organize the states in the country and the private industry into community-based task force, community-based task force for testing throughout the country. And so all that, the Army reorganized, but we also undergirded Health and Human Services, FEMA, CDC, with Army personnel augmenting their staffs to help us get after the whole of government approach for COVID.